startled a lot of folks, even though we had hints of where he might be going earlier this week when he last appeared with me on Fox Business Network. Joining me right now, Ohio Democrat John Boccieri. Congressman, very good to have you.
Thanks for having me, Neil.
Why the switch?
Well, first of all, I was very clear that I believe that the system needs to be reformed. We needed to do it in a way that doesn't explode our deficits and go for as much cost containment as we can find, and certainly go after the waste, fraud, and abuse in the system. I believe at the end of the day, this bill goes farther than the House bill and the Senate bill to reduce the deficit. $1.2 trillion is what we're talking about in the second 10 years, and $138 billion in the first 10 years. For this fiscally conservative Democrat, that is a huge leap forward and one of the largest deficit reduction packages since the 1994 Budget Reconciliation Act.
Nevertheless, Congressman, when you and I were chatting a few days ago on Fox Business Network, which, as I always like to remind folks, if you're not getting, Congressman, you really should demand, you did sort of tip your hand. This is from earlier this week. Where are you leaning?
Well, Neil, I believe that the country needs to have this debate. We need to have reform. We need health care reform, but we need to do it in a way that doesn't explode deficits, that contains costs, and goes after the bad actors who propagate fraud, waste, and abuse in the system.
So I take it that the president, and with the final CBO scoring, which isn't quite final, Congressman, addressed those concerns.
They did, Neil, and let me be frank with you. If the House bill were up for a vote today, I would vote the same exact way. I believe that the numbers were going to be lower because of the cost reduction and also the fact that we were going after more fraud, waste, and abuse in the system, and that's why I ended up where I am today.
So what was all this drama about you not joining the president on Air Force One, and Dennis Kucinich did, and people implied, well, that's a sure sign as any that Boccieri is going one way and Kucinich is going another?
Well, I want to make this decision on my own. I have been very clear that this is a dialogue that I've had between my constituents back home, and you may have seen some of them there today, and certainly the president talked about Natoma Canfield, the woman who is hanging on for her life in the Cleveland Clinic right now. She is one of the reasons why I believe that the system needs to be reformed. Ending pre-existing conditions, most abusive practices of the insurance industry where they drop you if you get sick or deny you coverage. The young boy that I had by my side today had autism. Day one when this bill was enacted, they're going to end pre-existing conditions for children. Those are significant movements.
All right, Congressman, thank you very much. I know you're going to take a lot of heat for this back home, where a majority in your district are against this. But as you said, in the end, you voted your conscience that this was the way to go. However anyone feels, we'll see how it goes. Congressman, thank you.
Thank you for that.
All right, so we're still trying to get a final count of this. And again, I'm going to mention, and you're going to get tired of us mentioning, not only today,